Hello everyone, this is Dr. Jeremy Balbin from Centre for Health, and today I want to talk to you about a big question that I get asked by a lot of my patients and from the general public. The question is it safe to exercise after you've been injured or while you're in pain? So to answer this question, there are a few things that you first need to understand. The first and most important thing to understand is that pain does not provide a measure of the state of tissues. That means that the pain you're experiencing does not give a good indication of the harm that has happened. Pain is determined by a number of different factors, which the field of pain science explores properly. But it is a lot more complex than simply how much damage has been done. In fact, the relationship between pain and the state of tissues becomes less predictable as the pain persists. So the longer someone is in pain, the less reliable that pain is. So what does that mean? What does the research say about exercising when you're in pain? Well, what it says is that it can definitely be safe to get back into the gym and exercise when you're experiencing pain, and doing so can actually even be a good thing. In a 2017 systematic review by Smith, they compared protocols using painful exercise versus non-painful ones, and they showed that in people with chronic pain who performed the painful exercises reported significantly lower levels of pain in the short term. They concluded that the pain during therapeutic exercises for chronic musculoskeletal pain need not be a barrier to successful outcomes. Two more studies, one in 2019 by Hickey and one in 2007 by Sibinagal, looked at an exercise and rehab with pain for hamstring strains and Achilles tendinopathies, and both studies showed no negative effects from painful exercises, as well as many positive effects such as increased muscle strength, lower chances of re-injury, and many other significant improvements. So clearly, there is something to say for exercising when you're in pain, but there's a safe way to do this and an unsafe way to do it. So we use the following guide about determining when it's safe to exercise with pain and what amount of pain is acceptable. You'll see the graphic below, but essentially, if your pain is between 0 and 3, it's safe to train, and you may even be able to increase the load. If it is a 4 or a 5, it is safe to keep training, but keep the load the same. And if it is a 6 and above, then modify what you're doing and maybe reduce the load. Your pain and symptoms should quickly settle back to baseline after the exercise, so within 24 hours, and you should not feel any increase in pain or stiffness the following morning. If you do, you might need to modify things a bit. Your body is resilient and adaptable. Loading your muscles and joints when rehabilitating an injury is shown to have so many positive effects. It's important to stay within the safe zones, but also trust your body's resilience because it'll pay off in the long run. Remember, it's still important to see a health professional to get an accurate diagnosis to find out if it is indeed safe to exercise with your pain. But I hope this information has been helpful and it helps you get back into the gym and exercising.